Hi, I'm Richard Santucci, and I'm a reconstructive urologist at the Crane Center for Transgender Surgery. I specialize in gender confirmation surgery. Today I'm going to talk to you about penectomy or penile removal. Penectomy is a permanent procedure that is designed to remove the phallus completely so it is no longer present and no longer visible. Realize that the phallus has about as much structure showing as it does inside. So the internal structures of the phallus are not removed because that would be an unnecessarily large surgery for really uncertain benefit. You have to realize three important things about penectomy. One is that it's absolutely permanent. Once the phallus is removed, there's really no way to put the phallus back afterwards. Secondly, you'll be removing most of the erogenous sexual nerves in the genitals, and those will be gone forever. Thirdly, the urethra or peeing tube runs through the center of the penis, and so that has to be rerouted in a way that works for you for the rest of your life. There's two ways to do that. One is to bring the opening out down in between the legs. That's called a perineal urethrostomy, and you would have to sit to pee for the rest of your life. The second is to bring the urethral opening out at the base of the phallus, which is another possibility, although it might make peeing messy or difficult. The implications of doing this surgery are that it's done for gender dysphoria and generally specifically requested by the patient. The implications of not doing the procedure are persistent gender dysphoria with all of its inherent psychological risks and dangers to the patient. The risks of this operation are as follows. All surgeries have the same laundry list of risks: infection, bleeding, need for reoperation, acute pain because it's surgery, or in some cases chronic pain. That's rare but real complication for some people. The very specific complications of this procedure have to do with the urethral opening. While usually a urethral opening can be thoroughly made that takes care of you for the rest of your life, some people have scarring and narrowing at the urethral opening that requires a short revision surgery at a later time. So during this procedure, you will be gently put to sleep under anesthesia, and the phallus will be removed basically down to the level of the pubic bone. This requires that the nerves, arteries, veins, urethra, and structure of the penis itself are completely and permanently removed. At that point, the urethra will either be rerouted to a point underneath the scrotum or in the so-called perineal area, and that's called a perineal urethrostomy, or it'll be brought out to the skin at the base of the former penis, as you prefer. That wound is then closed up, and I generally place a biological glue over that so that you can immediately take a shower and you don't need to do any special wound care. This procedure can be done together with other procedures such as scrotectomy, removal of the scrotum, or orchidectomy, which is removal of both testicles, as desired. Thanks.